This series of videos was designed to provide educational content for federally qualified health centers and rural health clinics to assist with their telehealth implementation. The content is also useful for other types of providers and organizations. The following video will cover these specific topics.
Hi, I'm Aislinn Taylor, and today we'll be reviewing key considerations for contracting with a specialty service provider for telehealth. In this presentation, we will be mentioning different types of telehealth. So these are the four most common. There's live video conferencing, store and forward, remote patient monitoring, and the direct-to-consumer model telehealth. So these considerations we're going to go over today will be presented in 20 questions, broken down into these four groups. Key categories are getting to know the specialty provider group, defining those expectations, setting communication terms, and additional support considerations. To get started, it's important to consider specialty provider groups each have different policies, procedures, credentialing preferences, and billing models. All of this is important to understand fully before making a final contracting decision. So to get started, you want to ask what specialties are available through this provider group. Some providers offer one specialty, for example, behavioral health, while others will offer a wide variety of specialties like you can see on the screen. Some clinics prefer the one-stop shop method for all their specialty needs, which does simplify the contracting and credentialing process. But other clinics do prefer to kind of shop around for the best price or service for each individual specialty. Next, you'll want to make considerations for their credentialing policy. By proxy or full credentialing will make a difference in how fast you can bring a specialist on board. If you're billing on behalf of the specialty provider, you will need to bring them into your four walls and will need to credential them at your site. Some specialty providers will only utilize credentialing by proxy, while others will accept your wishes for full credentialing. In addition, you're going to need to keep in mind the specialty providers will need to be credentialed with the patient's health plan in order to be able to bill for a service. You'll next want to ask about the referral process. Referral guidelines are an important communication tool that specify the time required for new and follow-up patients, as well as if and when a provider should be in the room during a consult. And finally, the information that is needed prior to the consult. For example, it could be labs or chart notes. This is helpful so you know exactly what the requirements are for patient referral, as they may vary depending on the specialty and individual specialist providing that service. Next, for billing models, you'll want to ask, does the specialist provide group contracts with your payers, bill by the hour or block of time scheduled, by the patient seen, or some other scenario? There are a variety of billing models used by specialists and specialty provider groups. It's important to discuss these and establish a model that's mutually beneficial in advance. This will help you to determine the financial model that best fits in your program. One thing to keep in mind before you negotiate, you should know how many referrals you think you will have for each specialty group and how soon you will be able to start. So depending on the specialty services needed, as well as the volume and modality for each specialty, rates will vary. You'll want to ask, what are the specialty service providers' rates for live video and store and forward? Are they the same or different for adult versus pediatric specialties? Rates for store and forward specialties will typically be lower than live video specialties, and new patient appointments may be more expensive than a follow-up appointment. Keep in mind that if a specialty group bills by the hour, it's important to know what time is required for new and follow-up patients. If a specialty group bills by the completed counter, the rates may be higher than the hourly rate. So next we get into defining expectations. Just like hiring any new staff member, it's important to find someone that fits within your organization's culture. It's also helpful for the specialist to know what your expectations are of them and what the specialist's expectations are of you. The following 9 questions will help clarify those roles. So some specialists will have a preference and may not be willing to let you determine who's present with the patient. You'll want to ask what the specialist expectations are of an MA, RN, NP, PA, or MD to be in the room with the patient during the encounter, and for how much time will they need that person in the room. Agree in advance how much time they will require staff to be in the room. This is hugely important to know for staffing, scheduling, billing, and budgeting purposes. For appointment time, you'll want to ask what the expected time frame that specialists will need for new and follow-up patients. This is crucial to know when the billing model is to pay by the hour, as you will need to structure your appointment schedule strategy to ensure you can financially afford that specialist time. You should set expectations up front with the specialist and hold them accountable to timely completion and transmission of all consult notes after the completed visit. This is not only important for the maintenance of provider-to-provider communication, but also for continuity of care and billing purposes. Some specialty service providers require the originating site to access their EHR to pull chart notes for each patient, and others will agree to document directly in your EHR, which is slightly more work for the specialty site, but easier for your staff. You'll also want to clarify what the onboarding process is for new clinics. Provider groups may offer training on patient presentation techniques, training on referral process, or equipment usage and basic troubleshooting. They also may provide video meet and greet sessions with the specialists and referring providers. Some or all of these may be of no cost to you, while others may come with a small charge. For continuity of care, you'll want to ask, will you be able to utilize the same specialist that has already seen the patient, or does it depend on availability? Maintaining relationships with the same specialist helps you feel confident in what your expectations are and ensures continuity of care as it pertains to diagnosis and medication prescribing. Also, having the patient be comfortable and have formed a relationship with that same specialist is crucial for trust and compliance with treatment recommendations. You'll also want to clarify their policy on patient no-shows or cancellations. Each specialist may have a different policy, and it's important to know upfront if you are able to cancel or reschedule patients and what the financial responsibility would be. Knowing that there are often no-shows with patient appointments, most specialists will allow and/or expect you to overbook patients. And they will most likely have some guidance for you as to what booking models work best for their telehealth clinics. It's important to establish what you mutually agree will work and will not disrupt the practice and the telehealth clinic. So ask if the referring site is allowed or expected to overbook. So direct patient care implies the specialty provider will make a diagnosis and treatment plan and prescribe that medication independent from the PCP. With the consultation-only model, the specialist will send treatment recommendations to the PCP, who will then be responsible for prescribing that information. So you want to ask, does the specialist provide that direct patient care, or is it consultation model? This would be important to know since you want to discuss this with your providers to see what they're comfortable with for prescribing patients medications after reviewing the specialist notes and recommendations. You'll also want to ask how those medication refills will be handled. It's important to discuss who will be responsible for medication refills and how prior authorizations will be handled. For example, if the provider operates in your EHR and is using eScript, you will want someone to handle these refill requests and prior authorizations just as you would for any other providers in person. So for specialist credentials, you might want to ask if the specialty group will provide a bio and a picture of that doctor. It's kind of reassuring for you and your patients to see the level of education, training, and any affiliations or board certifications that doctor may have. The sample form that's shown on this slide is a patient handout that has been used to describe in very plain language what that patient can expect from the telehealth consult. It also shows the credentials and qualifications of the specialty provider. Communication tools like these go a long way in making your patient feel comfortable with telehealth, as well as a big factor in reducing the no-show rate. So the next 5 slides will focus on communicating between the staff clinic and the specialist. Proper communication between the staff and the specialist is very crucial for a smooth flowing clinic. So you'll want to ask if the referring site provider can call or videoconference the specialist before or after the consult. The reason you may want to ask is because sometimes there's a need to speak to the specialist without the patient present. So you should ask if that's acceptable and if there is a cost associated. You should set expectation upfront with the specialist and hold them accountable to timely completion and transmission of all consult notes after the completed visit. Ask what the turnaround time on charts being returned and the method for how they'll be sent. This is not only important for maintenance of provider-to-provider communication, for continuity of patient, but for billing as well. You will also need to address what type of communication, for example, text, email, or phone calls, can be used when either the staff has a question or the specialist needs a staff to step into the room at any time during the consult. This information is useful to provide the coordinator the proper tools for a smooth flowing clinic. Sometimes clinic coordinators are not issued cell phones, or the room where the telemedicine equipment is located at the site isn't near a station that's equipped with a desk phone or computer. Discuss if calls, emails, text messages, or flags in patient charts are acceptable, and can these items be communicated directly provider to provider or only through a third party, such as a coordinator, scheduler, or receptionist. So let's shift gears a bit now and talk about technology support and backup plans. While most healthcare organizations have some level of technical support available, some do not have staff that are able to troubleshoot for telemedicine, the equipment, or the broadband connectivity. All provider groups should have a policy in place for technology failure. Some specialty groups provide a basic level of technical support or troubleshooting assistance in order to make sure services are provided as schedules. You should ask what level of technical support the provider group will provide. You should also ask what the emergency backup policy or plan is for technology failures. How many attempts to reconnect should you make? Should you call the specialty service provider's office, or will they contact your coordinator? What is the process for finishing the appointment or rescheduling should the patient not be able to connect? All provider groups should have a policy in place for technology failure and work with your clinic. So those are the 20 questions. These 20 questions will help you get started on your way to finding the perfect provider group for your organization. The information in this presentation is available in an easy handout on our website, so please check out caltrc.org. And thank you. For more information or assistance with your needs, please contact your regional telehealth resource center.
This series of videos is presented to you by the National Consortium of Telehealth Resource Centers, the NCTRC. The NCTRC is funded through the U.S. Department of Health and Human Services, the Health Resources and Services Administration, and the Office for the Advancement of Telehealth. This map represents the NCTRC, which covers the whole United States and includes 12 regional TRCs and 2 national TRCs, which are the National Policy TRC and the Telehealth Technology Assessment Center. The TRCs have been in existence since the early 90s and were established to provide assistance, education, and information to organizations and individuals seeking information on providing healthcare at a distance. The NCTRC mission is to expand availability of healthcare to underserved populations through telehealth. For more information about telehealth, the NCTRC, one of the 2 national TRCs, or your regional telehealth resource center, please contact us through the NCTRC website. Thank you for joining us in reviewing this video series.